Good morning guys, it's 5:30 in the morning and we are on our way to Mittal Hair Clinic in London to see Dr. Manny. He's doing a hairline procedure today. I don't know how these guys do it every morning, 5:30. I'm knackered, genuinely, but big respect to Dr. Manny and the team. But yeah, today you get to see Dr. Manny doing what I think he is one of the best in the world at doing, a hairline procedure. So I'll see you guys there. It should be a good day, and yeah, you get to see some artistry at work. Don't know if I mentioned, guys, but the actual clinic, the Mittal Hair Clinic, is in Farringdon in London, so it's a pretty nice area. A lot of people stay in the hotels nearby. He gets a lot of international patients. Had some billionaires in recently as well, which is pretty cool. You got to say, Russ. Alright guys, so when you come to the clinic, you get to meet
the grumpy old man.
The dude.
It's too early in the morning.
The
Do not
manager.
speak to me before 9 o'clock in the morning. Tom, would you stick that device?
Alright guys, second stimulant of the day. Early start. Not a morning person. Dr. Barry.
How are you? Okay?
Good.
We marked something on your head last time. The idea is to improve that frontal 1/3 of you. It should be an age-appropriate hairline. So when you're driving your drop-top coupe, the wind is not a problem anymore. Okay? I remember that you obviously recently sold your business as well, so you've got a bit more time. Enjoying life. I want you to be able to feel confident in yourself. Okay? So I'm going to mark something for you. Do you have any thoughts specifically on what you are hoping for today?
No, when we discussed last time, I might just follow that line.
Brilliant, fantastic. So if you remember, there's the outline of the hairline, and then you have something called the shingles point, which is your forelock, which has to be of the highest level of density, okay? Otherwise it won't look great, and that's what we're going to be focusing on today.
I can spot a good donor area already.
Yeah, it's got to be a good donor area. Something like that?
Yeah.
Very similar to what we drew last time.
Yeah.
This is the lowest point that we'll be working from. There'll be another line that I mark off just behind that. That's your transition zone, okay? So it should be irregular placement at the very front of the soft singles, followed by doubles to transition into your triples that you're going to give me a whole load of. We're going to dye your hair today because you've got very salty hair. Less pepper, more salt. That's going to help me see the individual hair follicles a little bit better to see the angles I need to extract from, okay?
Okay.
Do you have any questions about how today's going to pan out?
Not really, no.
Medication-wise, remind me, do you have any allergies?
No allergies.
Good. And would you like a little bit of Valium today?
Always.
Valium for everyone. You can't start your day without an espresso. But if you have a look, Russ has been a little bit cheap and given me half an espresso.
Jeez.
I'm a double espresso kind of guy, Mr. Russ.
Well, you played at, Russ.
It's only 7:59. You know, do not speak to me until 9 o'clock.
It's the quote of the day. You've got a good head shape though. Better than mine, I got a flat spot on the back.
Never thought I'd be seeing him today.
The beautiful thing about dye is you can see what we call vellus or poorly growing hairs even within the donor area. So if you compare it to this here and then this one here, there's a marked difference between the caliber of the hair follicles. And he has some of those throughout, perhaps a little bit lower down, like this one here would be a slightly more miniaturizing hair graft. And this is why I like putting dye on people's head, because it really does highlight the better hair follicles from the lighter hair follicles. You ready?
Let's kick off.
How bad is this on a scale of 1 to 10?
2 or
Amazing. Hard as nails. So we've just completed the anaesthetic phase. That's the first part of the procedure. We're going to just test to make sure he is still nice and numb. If he is, then we'll start making some holes into the back of his head. Good graft. Yeah, he's got really nice graft. So you look at a few things. Number one, the depth at which we have to make the holes to get the grafts out. He's got a fair number of doubles and triples. Minimal bleeding, which is always a good thing. Slight splay to some of the grafts, which means that they're doing the splits a little bit. So you just kind of take your time on extraction.
Gabby's got to make a click for every single graft. So which machine are you going to be using today, Dr. Manny?
So today we're just using our standard hair tip nail drill.
And what is the reason for choosing that today?
Sometimes grafts come out quite nicely. This is kind of the device that I use probably. There's a lot more scar tissue in the back of the head. Virgin heads, for me anyway, this is the holy grail.
So Dr. Manny said that you just sold your business, is that right, Daniel?
about 2 years ago.
Oh, nice.
Stock fridge.
Exactly.
Very good.
So what we got going on here, Adonna?
I'm separating them into singles, doubles and triples and fours, because he has a few fours. And that way we can then trim and neaten out the singles.
Alright guys, what we're saying about the surgery shoes. What are those? Look at that. Got them in sport mode. Pretty comfy. Rate the drip. 1 to 10 in the comments. Alright guys, so you end up coming to the Mittal Hair Clinic for a hair transplant. One of the people that you might come across, or what you almost certainly will come across, is Mr. Russ. Russ, we haven't given you a proper formal introduction, but how long have you been at the clinic?
Too long.
Too long?
Yeah. 4 years.
And what are the key things that you'd say set Dr. Manny's clinic apart from other ones in the space?
One of them I would say is he's one of the best in the world, top 3 in my eyes,
Yeah.
potentially top 1. It's the way he actually deals with the clients, and also we're trying to work out a word he can create. If he actually does 2,200 grafts, he concentrates it so it actually comes out or looks like 4,000 grafts, which not
Makes them stretch further.
Yes.
Yeah, and that's really important, guys, because in your donor area you literally do have a very limited supply, and once you've burned through them, then you don't get them back. So that's why Dr. Manny was one of the people that I was considering when I initially figured I'd need a hair transplant. Managed to get away without one for now, but you know, in the future, if I do need one, then I'll be going to Dr. Manny because it does make those grafts stretch a lot further. Another thing that is good about the clinic, he's got Russ.
Hello.
Here's Adonna. You guys will probably see Adonna if you come in for surgery.
Always.
Onto the wire machine.
Yeah, so this is the wall machine. The skin is a little bit more delicate on the sides here. Grafts tend to be a little bit more splayed, which means they're kind of doing the splits, and oscillation is generally better on the sides up here. It's called the wire because it has a foot pedal which is on this side here.
Okay, so what we got going on here, Ali?
We're just separating all the grafts in ways of singles, doubles and triples. He does have some very tiny hairs, which is mostly singles. We're gonna keep them separate and doctor will decide what we're doing with them at the end.
Those are your vellus hairs. So the ones that don't really grow beyond a certain length, which can be part of a follicular unit in itself. If we put it in the head, it'll probably help with density at short levels, but it won't give him length. You have to be strategic on how you use those grafts.
Yeah, and then when we're looking at these grafts here, Dr. Manny, how would you implement them in terms of creating that hairline today?
We don't know yet. Once I've turned them around and I
have a closer look at the pores that are there, based off of where he's already got pre-existing hair. I'll then strategize where, so singles are still going to go at the very front, of course, then there'll be a transition, and then it will be a case of where we put the triples and doubles subject to numbers that we have.
And why is it so important to have those singles in the front?
It aids naturalness. I mean, look, the thing is even if you looked at my hairline, there's the odd double naturally found there, but because the nature of the hair on the back and sides is a little bit thicker in diameter, a little bit coarser. If you have doubles riddled in the hairline, it looks plucky, it looks, unnatural. It doesn't look particularly good.
So what we're doing here, people watching?
I'm basically trimming the grass to make them into perfect singles, so there's no any excess skin or debris.
Just neating them up.
Just neating them up, yeah, refining them. They're refining them. So you basically want them to go from looking like this, I don't know if you'll be able to see,
Try and focus it.
to looking, Ali moves his hand, like this. I don't know if you can see close enough, but look at that one up there. It's got the excess skin, excess hair, there without a root, then transected on the side to just one nice, neat and refined.
A refined graft.
Single graft, yeah.
Nice. So Dr. Manny, could you explain to everyone why you don't like to go typically too far beyond around 2,000 grafts of surgery?
Yeah, so the max we'll do is 2,200 to 2,500 in a single session. Just patient tolerance levels. Try and make it as comfortable as possible for our patients. When you extend the day to 12 to 14 hours, knowing it's going to take that long on 3,000, 3,500 grafts in a single day just becomes intolerable for the patient. We're professionals, so we'll probably still be able to crack on, but it's just not nice for these guys. Anesthetic starts to wear off, and then you have safe limits that you can administer anesthesia with. There's body weight and a certain cutoff. Beyond that, anything more, you start entering toxic levels. And then finally, and probably most importantly, there's only so much blood supply that's able to nourish those grafts in a single session. So if you overcook something, it inevitably destroys the entire procedure. So it's always better to do less. Worst case scenario, bring them back for more. Maybe do it over 2 days. And also, I think as surgeons, you should always leave your patients with a bit of a parachute. Like our lovely patient today, he's of a mature age. He's probably not going to lose a great deal more hair as he ages, but you never know. And as he does, you may want to come back for more. And if you strip everything out, session number 1, don't really leave your patients a parachute. God forbid he could go out tomorrow and bang his head, and that's happened to us in the past. So I'm like a big believer of learn from your own experiences, and sometimes your patients, less is more.
And the anaesthetic with body weight thing, I feel like that's something a lot of people don't know about, because obviously the heavier you are, the more anaesthetic you can tolerate, correct?
Up to a certain level.
Yeah.
With adrenaline, so we use lidocaine, it's generally 7 milligram per kilo, and I'm very cautious and about the anaesthesia levels that I give, so it would be 7 milligram per kilo up to 70 kilo body weight. Anything beyond that, again, I try and avoid as a maximum level.
And what are some interesting things that a lot of people don't know about hair transplants?
People look at other people's results and think that they're going to be guaranteed those results themselves. It doesn't work like that. We can only work with the donor area that we're given.
Yeah.
And some people will have electric donors and some people won't. The better the donor, the better the result. But as a surgeon, you need to know how to utilize, that was my Lithuanian accent coming out right there, my friend, utilize the grafts that you have been given. And I think that was a question that you asked me earlier, how are you going to use the grafts that have come out?
Yeah.
The answer is I don't know until I get a good number or a good estimate of the number of grafts. So you heard my colleague there tell me that on this side here, on this right hand side here, even though I used the WOW, we were getting a higher proportion of singular hair grafts on his right hand side of the head, which is what I expected he would give us anyway. But then I have to find a way to use them.
Yeah.
Everything is art, not science really.
Based on the individual as well.
Based on the individual.
Yeah. What are some of the most challenging situations to deal with when it comes to an individual?
When you don't have nice patients. Today we're really quite blessed. We've got a guy who is really quite laid back, relaxed.
Shout out Daniel.
Yeah, man.
And what are some of the key things that you do, Dr. Manny, that make a result look natural and like someone hasn't ultimately had a surgery?
I respect the anatomy. I respect natural aesthetics. I respect where his muscles sit. I respect the grafts. You know, everything. You have to have a respect for the anatomy that you're working with. If you don't, then it just becomes labour. You need to take away from the art form, understanding where singles, doubles, triples really need to go, making sure that your team can execute the plan that you've laid out, you know? And it's actually very intuitive for these guys now. I'll come in and say, oh, did you do this? Yeah, already done it. I like that. I like it when you work with people so long, they can already predict what you're going to tell them to do.
Yeah. And how important is a good team?
It's the most important thing. I could be the best surgeon in the world, but Lionel Messi be without Iniesta and Xavi. And Pep Guardiola over here spraying their head right now.
So check this cap that one of Dr. Manny's patients gave him, guys. It's got the loading thing on it. Pretty cool.
What?
On looks, Maxon. Do you know the difference?
How I know you was looking at yourself. It's because you're doing that smouldering look.
The smouldering. Wait, do it. Go on. Like that. Jeez. Do you know the different types of looks, Maxon? Like that. You got soft Maxon, which could be like you'd put on, I don't know, like some SPF or whiten your teeth, nothing too invasive. Then you got hard Maxon. You enable the hard Maxon for a hair transplant because it's full surgery. You allow people to ascend.
It's all good, man. It's restorative.
Ascension professor. Yeah, Russ, you look different today.
I'm not even a good looker, so I might have to kill you.
Do I look different today?
Yo! Bro's mogging.
Yeah, man. You see, it looks maxing to max.
What did you do to ascend?
Yeah, I went and lost some weight, grew some hair, lowered my hairline, chiseled my jaw out, a little bit of filler.
Jaw maxed.
Look at this hair though, man. Oh my days. Look at that hair. That is some good hair.
That's come up.
Some good hair.
Hair maxing.
I've been looking like a punk rock star.
You wanted to have a Justin Bieber hairstyle.
Did you? Do a looks maxing face. Where you go? Okay guys, it's 1 o'clock now. Getting a little bit tired to be fair, so I had to caffeine max, secured the white monster. Always brings me back to life. I'm not built like these guys, I'm not used to the 5:30 AM starts, but almost done. Procedure going well. Chilled day as always in the Mittal Hair Clinic, so. 4th stimulant of the day. Going strong.
Keep coming, keep on.
Streetlights painted gold streaks on the rain-slick pavement.
So we're on to the next phase now. What we're going to do is we're going to just pass him some more Donald Trump. So Ali, if you can, Ali, you pass him the Donald Trumps, mate.
Yes, I'm listening.
Go.
Thank you.
Okay.
No worries.
Bit of anesthetic.
Yeah.
Generally, people normally say the back is worse than the front. Let's see if that's true with you. So we're going to just give a ring block for this gentleman. Sharp scratch, which means that we just go around.
More than the back.
Really scratch. I would think that the sharp scratch. So being an entrepreneur yourself, do you have any advice that you'd give to other young budding entrepreneurs?
Yeah. Take bigger risks earlier.
What do you mean by that exactly?
You waited too long to hire more people
Uh-huh.
and move to a bigger office
Uh-huh.
because of the costs.
But cash flow is also important, no? So if you move
Always.
to a bigger office, won't that affect your cash flow?
Yeah, but that's the risk.
In your own hair, said there's no turning back, and you're tracing constellations.
So here what we're doing is we're doing interlocking incisions, and that's how you create the illusion of a fuller head of hair. And that's ultimately all that we're doing. It's kind of like, if you imagine bricks being laid, you kind of form a diamond pattern. It's always fairly similar all the way across, and what I'm trying to do is I'm trying to locate the individual hair follicles that would have previously been there. So if you look close enough, you can see there's a little circular sweat gland around this hair follicle, but there's no hair follicle in this sweat gland, for example. So if I make the incision from the roadmap that's been left behind, you can create next to natural looking results every time.
And could you explain the importance of the angle?
The further back you go, you're sort of going more at 30 degrees. So if you look at the exit angle of this hair here, if you come side on, you can see it's kind of going off to the right, but maybe at 30 degrees. It's got a lot of that, to be fair. Like here, it's more perpendicular. You can see the hairs stick up more upright. These hairs want to fly off to the right a little bit. Did you ever have a subtle cow's lip when you was younger?
Yeah.
You can see
it was in the family.
And for people watching, could you explain the different zones that you've got marked out and the importance of them?
Yeah, so the first line here, this is just the limit to which we're going to be working today. Then you have a temporal peak closure on the sides here, either side. And then this here is probably the most important area. It's called the shingles point, or the forelock region. That's normally the area that you should have the highest level of density, because the eye is drawn to the midpoint of the face. And if the midpoint looks nice and full, the rest of the hair will look nice and full. Yeah, itchy is probably the better.
What's the full timeline of return to activities for people watching Dr. Manny?
So, after 2 weeks, you can start doing cardio at 50%. At 3 weeks, you can start doing cardio at 75% and weights at 50%. And at 1 month, you can go back to your normal routine, subject to there not being any significant post-procedure complications. Swimming, freshwater swimming is absolutely fine, even 2 weeks to be fair. The chlorinated water, I always recommend wearing a cap regardless. Always wear a swimmer's hat in the swimming pool. So here, what we're doing now is we're onto the final phase of the hair transplant procedure as a whole, and we're implanting the grafts one at a time. What I'm doing here is a form of direct hair implantation technique for our gentlemen. So this is the VIP tier implanting technique. I didn't have the patience to learn full-step implantation. The learning curve on this is a whole lot shorter, quicker, and I never decided to use the other method.
So walk us through what you're currently doing.
So what I'm doing is I'm holding the graft from the skin end. This has a sweat gland, which you can see the bulging bit, and then you have the stem of the hair follicle as a whole incision that I've created. And that's what we're going to do. Yeah.
I can vouch for that as well, guys. Dr. Manny literally did say he gets excited to get back into surgery. This is beautiful footage, by the way.
It's actually something strangely therapeutic about it.
Yeah.
Extremely meticulous as well.
So what's the most important factors when it comes to implantation, Dr. Manny?
Making sure you look after the bulbs. That's the most important thing. Because if the bulbs are crushed on entry, then the grafts will never grow.
And for people watching, could you just explain what the bulbs are super quick?
In this graft, it is a triple, for example. You've got 1, 2 grey hairs, 1 black hair. When you're implanting it, this is why I always hold it from the skin end. When you implant it, you basically make sure, take care, the bulb is not being crushed upon entry. It goes in nice and straight, if it goes in nice and straight. So actually, the implanting is largely dictated by the quality of the incisions. If the incisions aren't good, then implanting will de facto be poor as well.
And in the situation where it did get crushed, what would happen?
In the situation where it did get crushed, the graft just probably wouldn't survive, and if it did grow, it would probably grow badly.
So what we're doing right now is we're doing a little spot check and we're finalizing where we're going to put the remainder of the grafts. I may decide that I want to take out a few extra grafts just to, because I've got issues. Yeah, I need it to be perfect.
Talk us through where you're up to in these final stages, Dr. Manny.
All the incisions that I originally made are filled, but I made some more incisions just because I feel like it could do with a little bit more. And now I need to take out a few more grafts, which will probably take this count to about 2-4 in the end. We're about 2-3, 2-5 at the moment, and then we can put them back in and then we're done for the day.
Do you think we'll be done by 5?
Oh, latest.
Yeah.
How many more grafts left now, Doc?
You know, I actually don't know the answer to that question because I punched extra. So until they finish now, basically.
Yeah.
But I punched an extra 100 or so grafts. I'd expect grand total to be something in the region of 2,400 or so grafts for this gentleman. We had to do a few extra extraction plates just because when sometimes people give a few extra singles, you need to make sure that you put incisions in a little bit closer to one another. That way you're going to get better density. That's what we've basically done for this chappie today.
What does this do, Dr. Manny?
This is just the final spray down of the head. What helps to lock the grafts in. Final cleaning, making sure no surplus bubbles have been left on the head. Bit of spray. Pretty much stop bleeding now. Little bit of bruising. Any pain on the back, my man?
No.
I like that. You earthed yourself nicely. That's a manosphere thing right there. A little bit of residual bleeding. I'm going to give it another spray down now to try and help with that. But that's for a new hairline, I think. It's good, isn't it? Yeah. It didn't look so good an hour ago after the tweaking of another 150, 160 grafts. Yeah, I'm happy with that. So what we're doing now is we're just wrapping up the procedure by putting a compression dressing on the back of the head. This will come off tomorrow at 4 p.m.
Right.
Lauren tends to create a group chat with all of our patients in, so you have direct access to me. So you send me a picture every single day at 4 p.m. in essence, so I can see what's going on.
Yeah.
But my goodness, my man, that frames your face absolutely beautifully. You have a better side and it's your left side. That's your picture side, alright?
Alright. Lauren said every 10 minutes when I'm driving back, so that's not the case. That's good. My taxi
with you? No. So again, normal protocol, not every 10 minutes, a bit extreme.
Yeah.
But every half an hour usually. But because of your oiliness to your scalp, I don't want you to overspray. It will make your body want to produce even more oil, which can lead to ingrown hair follicles and infection. Had your hair transplant procedure, 2,425 grafts for you. You gave me a lot of doubles, you gave me some triples, and you gave me a lot of singles, okay? The grand total of hairs is circa 5,000 plus hairs. There's a lot of hairs that have gone into your head, so well done. You're going to spray your grafts every 2 hours up until 10 till midnight tonight, okay, to see how you feel. You're going to position yourself in an upright position, so the best place to be is in the corner of a sofa. Do you have like a chase end on your sofa?
Yeah, I do, yeah.
Fantastic. Cocoon yourself into the corner of that sofa using this aeroplane cushion to keep you propped up. You're going to be circa 45 to 50 degrees, so that the swelling could track down your head a little bit better. Alright? Generally, swelling peaks at day 3, settles by day 5. Tomorrow at 4:30 p.m, you're going to remove these bandages on the back and sides of your head. How are you going to do that? You're going to soak the tape in a little bit of saline either side. This tape and this
Spray
tape.
it.
spray it with a little bit of saline.
On that note,
Thank you.
And it will you'll then gently be able to prise everything away. If you find that your bandages are getting caught on anything on the back of the head, please use a bit of saline spray there too. Don't just rip it off.
Yeah.
If you notice any residual bleeding tomorrow, I would like you to apply some firm compression using the swabs to the back of your head for me. Hold it there for a minute or so, and then you discard accordingly. You do not need to rebandage the is this my hat, yeah?
No, it's my hat.
What do you mean? Antibiotics. You're going to take one antibiotic every 4 hours. You've taken 2 doses so far, and you need to take another one now, and then your final dose at 8 p.m. if that's it. Well, it's 5 o'clock, so call it 9 p.m. tonight.
Just one, yeah?
Just one. Tomorrow, you're going to restart again, 8, 12, 4, and 8. Just keep it nice and simple every 4 hours for me, alright? That's going to mitigate your risk of infection. Again, tomorrow, when you wake up, you're going to spray your grafts every 2 hours whilst being awake. Again, the idea is to help it try and form its own individual scabs, but with you in particular, I don't want to over spray because I don't want it to produce too much oil. So you keep doing that throughout the day, taking your antibiotic. Day 2, pretty boring. You're going to be sprinkling your grafts through the day, taking your antibiotics, and that's about it.
Still 2 hours. Yeah.
Every 2 hours, just during the day. Day 3 is your first non-contact wash day. On this day, so today's Monday, Tuesday, Wednesday, Thursday. On Thursday, you're going to do a non-contact wash. So, what do I want you to do? I want you to take the baby shampoo and put a good dollop of it into the bottom of a jug or a bowl. Within that jug or bowl, you're going to put approximately 400 ml of lukewarm water. So sometimes it's even quite useful to have a water bottle and do it with a water bottle.
Yeah.
Take the shampoo, put it in there, put the water in, give it a good shake, and then you can actually pour over the transplanted area, okay? A gentle pour. Whatever you do to the front, you're also going to do to the back. So gently pour, gently pour. Then you need 3 to 4 bottles, jugs, bowls to rinse. And the idea is to get rid of those suds. I don't want any more suds to be forming the bubbles in essence, okay? Do that in the morning of day 3, morning of day 4. So that's Thursday and Friday. From Saturday onwards, you're going to start doing contact washes, okay? What are contact washes? It's the same principle as before. Fairy water goes onto the transplanted area, take some of the shampoo, put it into your hands like so, generate a nice lather out of it. You're going to pat it out over the transplanted area, okay? You're then going to take the pads of your 2 fingers here, index and middle finger, and you're going to do slow, gentle, circular motions like this, okay?
Everywhere.
On the transplanted area to begin with. But you're right, whatever you do to the front, you're also going to do to the back. So do this one first, rinse off, do that for about 2-3 minutes, rinse off, and then you repeat the process again.
So just really gentle like this.
So a lot of people ask the question, how much pressure do I actually need to apply, Doc? The simple answer to this question is just enough pressure to get a nipple erect. Okay, so now you know. Now you know, nothing beyond that.
Okay.
Keep doing that daily. By day 10 to 14, the scab should be off. I've packed some aloe vera gel in here for you. I want you to only apply this to your donor area. Normally I get people to apply it to their transplanted area. Again, this can cause too much oil production. So on the back it's fine because they're empty holes. This is new holes that I've replaced the graft, so I don't want you to put this on until the scabs are off. Once the scabs are off, applying a light layer of aloe vera will help with the redness and help with the inflammatory changes that have happened, alright?
Yeah.
And that's it, man. That's pretty straightforward. There's an absorbent sheet here as well in case you want to put it over a pillow or over some of the linen or even over the back of your sofa so you don't soil it.
So I'm sleeping on the sofa, am I?
I would recommend that's going to be your best bet.
Yeah.
Because you probably have a TV in front of you.
Yeah.
Do things during the night.
Yeah.
Kitchen probably
So
not.
we'll be up.
Well, you could be. Not everybody is. Some people are. Some people aren't. But in general, it's just more comfortable to be in your sofa.
Yeah.
I've packed some minoxidil in here for you as well. So you're going to start taking 1 tablet a day from tomorrow. See how you feel on these tablets. It's not for everyone, but I do think you'll benefit from it. Normally people have bundles of hair that are the same length all the way around. You do not. Some hair is long, some hair is short, some hair is even shorter. Okay?
Right.
It could be that the different phases that the hair follicle is going through, but I want to try and push everything into the anagen phase. Minoxidil is going to help with that, alright? Okay. Check that in there. Bromelain. This is, like I said to you, pineapple extract. What does bromelain do? It helps to digest the bruising, clots, the stuff that's underneath the surface of the skin a little quicker. 2 tablets a day from tomorrow for 5 days, alright?
Anytime.
You can have it with food,
Yeah.
breakfast in the morning, and that's it. Prednisolone. This is going to help with a few things. Number 1, you had slightly sensitive skin on the back and the side, and slightly sensitive skin even on the top of the head. I want to dampen that immune system or inflammatory response by giving you an anti-inflammatory in the form of prednisolone. You can take 4 tablets once per day. This is to be taken in the morning though, alright?
4 tablets all at once.
4 tablets all at once. They
Okay.
don't taste particularly nice, so quickly down some water with it. Paracetamol. If you feel any pain, 2 tablets up to 4 times a day.
Can I take ibuprofen?
No.
Okay.
You can take ibuprofen from about day 5 onwards. Alright?
Okay.
Hopefully you shouldn't need to. That's your aftercare discussed. Do you have any questions for me specifically? This is a pen for you.
Nice.
Yeah, a bit of
Nice
match.
touch.
Can't help but take a bit of match out. Complimentary, of course. This is your saline spray. So how do you need to spray this? This you're going to hold approximately 10 centimeters away from your transplanted area, and you're going to give it 10 sprays. Now do it 5 one way, 5 the other way. Keep it nice and simple, alright?
Yeah. I don't have to go all the way around the back, do I?
No. You've got a bandage there anyway.
Oh, okay.
So it's not going to do anything there. This is just for the transplant.
Just for the transplant.
Okay. Here is a guest book, my friend. Okay. I like to ask people to kindly just leave a brief message, so that when I'm old and I'm retired, I have something to look back on. This is going to be your page, sir. Doesn't have to be a long message, just something very brief, very quick. And then I've got to give you some gold stars, take some final pictures, and then you're welcome to leave, alright?
Thank you so much.
Thank you so much. On that. So most people actually ask, what's the blue stuff, Doc? It's been a wonderful day, 2,425 grafts for this gentleman. Wonderful patient, should be a cracker. Stay tuned for the results. Thank you for watching. If you haven't already, please like, subscribe, follow, reshare. Go on, my man.
And the Mittal Hair Clinic will of course be linked in the description. Guys who are considering hair transplant surgery, tell them Tom sent you. See you in the next video.
Peace.